Hello, my name is Dr. Neil Baum. I'm a urologist in New Orleans, Louisiana, and I would like to take a few moments to talk with you about a common problem that affects millions of American women, female sexual dysfunction. In this brief video, I will discuss with you the causes of female sexual dysfunction and also what treatment is available for this common condition affecting so many women. The definition of female sexual dysfunction is the lack of enjoyment from sexual intimacy. It may be a problem with getting aroused, it may be a problem with orgasm, or it may be associated with lack of enjoyment and satisfaction from being intimate with your partner. Female sexual dysfunction affects 43% of the women in the United States, so you are not alone. Most of the time, female sexual dysfunction occurs after menopause. The causes of female sexual dysfunction include alcohol, depression, anxiety, emotional problems, illnesses, the problem of a negative body perception, and as well as stress. Female sexual dysfunction can be divided into two categories. One is hormonal, the other is due to vascular causes. The vascular causes are a result of decreased blood supply to the pelvic region. As a result, it causes reduced sensitivity, particularly to the clitoris and the vaginal area. It is also associated with dryness, and as a result, it impairs arousal and lubrication. Vascular causes of female sexual dysfunction are associated with medical conditions such as diabetes and atherosclerosis, or hardening of the arteries. Now, looking at the second cause, that is hormonal causes, as a result of decreased estrogen as well as testosterone, which is caused by aging. Estrogen is associated with the sexual desire in women. Testosterone, which is primarily a hormone produced in men, also is involved in a role of sensitivity of the breast and the clitoris in women. For those who have diminished sexual desire and sensitivity, it may be a result of menopause or hysterectomy, especially if the ovaries were removed at the time of the hysterectomy. There are other medical causes such as drugs and medications, birth control pills, drugs used to treat depression called SSRIs, the benzodiazepams, and chemotherapy drugs can significantly impact a woman's ability to engage in intimacy with her partner. Also, smoking has an effect on the blood vessels and decreases the blood supply to these very sensitive tissues. Surgery near the reproductive organs, such as surgery on the colon or bladder, can result in a problem of female sexual dysfunction. I also would like to point out that urinary incontinence or involuntary loss of urine can be associated with so much embarrassment that the woman wishes to avoid sexual intimacy because of the embarrassing situation. Vaginal atrophy is a condition as a result of decrease in estrogen to the vaginal tissues. The treatment of female sexual dysfunction is to identify the cause and then provide the treatment. If there is a problem of decrease in estrogen, then it is a simple matter to replace the estrogen level to reach a normal value. If the problem is a vascular disorder, then the underlying vascular disorder, such as diabetes, is treated. Hormone replacement therapy for estrogen deficiency or testosterone deficiency is as simple as returning the blood levels to normal, which can easily be measured by a blood test to check the estrogen and testosterone levels. Vascular disorders are to treat the underlying vascular condition, and there are topical creams such as gels and Sensua, formerly called Via Cream or Via Gel, which increase the sensitivity and assist in achieving an orgasm. Since Sensua is an amino acid consisting of L-arginine, which is a normal amino acid within the body, and the solution contains methyl. If it's applied to the clitoris, it will increase the blood flow by dilating the clitoral blood vessels. Viagra, which has been used primarily in men with erectile dysfunction, is currently being tested in women. Some evidence suggests that it may restore libido lost to antidepressant therapy, such as with the SSRIs. A handheld device called the Eros has recently been approved by the FDA, where it can be used 3 to 4 times per week to increase the blood supply to the clitoris and the external genitals in the vaginal area. It may take several weeks of conditioning before experiencing the benefits of Eros therapy. In summary, female sexual dysfunction is a common problem affecting millions of American women. It is usually due to hormonal or vascular or even psychological causes. Bottom line, treatment is available. And if you are suffering from female sexual dysfunction, speak to your physician, because you don't have to suffer the problems associated with female sexual dysfunction. I hope you have found this video helpful and useful. If you have any additional questions, I'd like to refer you to my website, www.neilbaum.com, or you're welcome to call me at my office at 504-891-8454. Thank you.